Hello, Ma'am Lean. I hope you're having a great day. My name is Christine Maytala, and today I'm going to perform a return demonstration on the proper way of doing hand hygiene and at the same time the donning and doffing of PPE. So let me first start by doing hand hygiene or hand washing. So of course, the first thing we will do as a procedure is to make sure that we are aware of the purpose and indications of hand washing. So hand washing is important for us to make sure that we avoid the risk of transmission of microorganism or cross-contamination of microorganism amongst our client. And the rationale for doing a hand hygiene is for us, of course, to avoid transmitting infection to oneself. Okay, so after we're done with after we are already aware of that, we also have to make sure that we establish rapport to our client. Okay, now after we're done, we now proceed to assessment. So for assessing, before the hand hygiene, we have five. Number one is the factor of susceptibility of infection and possible undiagnosed infection of the client. Number two, we also have to check if the client is using any immunosuppressive medication. Number three, if they have undergone any recent procedure that has penetrated the skin or the body cavity. Number four is to check the nutritional status of the patient, and then the last one is to make sure that we check for signs and symptoms of infection. Okay, so after that, we proceed to nursing diagnosis, and I actually came up with three nursing diagnoses that has something to do with hand washing and also the donning and doffing of PPE. Number one is risk for infection. Number two is risk for shock, especially for our client who has septicemia, and at the same time, we also have risk for impaired skin integrity. So those are the diagnoses that I actually came up with. And then after the nursing diagnosis, we are now going to do the planning. So for planning, all we have to make sure is that we know the location of the water source, and at the same time, we have soap that we can use. By the way, the equipment that we will use for the procedure, of course, is the water source. We also have the soap. We can either use a liquid soap or a bar soap. And we also have the paper towel that we will use later on to pat dry our hands. So after we're done with the planning, we can now move on to implementation. But of course, before we even go to implementation, there are things that we have to consider. Number one is that our nails are short, simply because shorter nails have, or the rationale for that is because shorter nails have lesser tendency of harboring microorganism. Okay, and the number two is we make sure that we don't have any jewelries. Okay, the reason or the rationale for that is because microorganism can lodge or can set on our jewelries, and at the same time, removal of jewelries can facilitate hand washing, or making sure that we can do hand washing very well. And then after that, we also make sure that we don't have any breaks on our hands. Okay, that is the rationale for that is because nurses with, of course, open sores may need to do a different assignment that will have a decrease of them transferring or getting any types of infection from the clients. Okay, so that's it for the preparation. Now, if you're doing a hand washing and the patient is there, the first thing you will do is to identify yourself, so that of course they will know you. And then aside from that, you verify the patient's identity, making sure that you follow the agency protocol. After that, you explain the procedure, why it has to be done, and at the same time, the agents are the participation of the patients onto that process. So after, of course, you've done those things, it is now time for us to do the hand washing. Okay, so the first thing that we will do, of course, is to make sure that we turn on the water source. So we turn on the water source, and of course adjust the flow. So we turn on and adjust the flow. So right now, I'm actually using a hand-operated faucet or a flow. There are five types, but then again, since this is the only one we have at home, I'll be using that one. And then after we've adjusted the flow, we make sure that we adjust the flow to make sure that the water is warm. The rationale for that is because warm water tends to remove less oil compared to hot water. Okay, so let me now adjust it. And then after that, we make sure that we wet our hands. Let me just move my camera so you can hear me. All right, there you go. So I just have to move my camera so that you can hear me better, since because of the water sound. So again, as what I mentioned, after I have turned on, okay, adjust the flow, and I'm using a hand operated faucet. Okay, we have to make sure that we turn it, or we adjust it into a warm, okay, warm temperature, because warm water tends to remove less oil compared to hot water. And then after that, we make sure that we wet our hands, okay, thoroughly. Okay, and of course apply soap to it. So in washing your hands, make sure that you wash it from top to bottom, because the upper part of the arm is less contaminated compare, and of course the fingertips are the most contaminated. That's the rationale. Okay, and so after that, we now apply some soap. So in applying the soap, since we're using a liquid soap, we make sure that we use at least 4 to 5 ml, okay, of soap. So now after that, we make sure that we rub our hands together. Now we're gonna be using the WHO recommendation for hand washing. So the first thing that we will do is to, of course, rub it, okay, and then our palm to the back dorsal part of the other arm, and then vice versa, and then palm to palm, and make sure that we interlace our fingers. And then after that, the back fingers towards the palm, interlock fingers. And then after we're done with that, we have to make sure that we also do rotational rubbing on our left palm using the clasp palm. Same goes with the other part. And the reason why we're doing this is because, you know, a circular motion can remove microorganisms mechanically. And of course, the reason why we're doing interlacing of fingers, cleanup interlacing of fingers, is because this will help us to, this will basically help us to clean the digital spaces. And now after we're done with this, we make sure that we clean our fingertips using the palm of our hands. Because sometimes, I mean, the rationale for that is because fingertips are most commonly missed, okay, during the hand washing procedure. So after that, we just rinse our hands. Okay, so we just rinse our hands very well. Okay, so again, in washing your hands, same thing. It's from the upper arm to the fingertips. Okay, now that we're done, avoid shaking your hands. Okay, we can now get paper towel to pat our hands. So in drying your hand, making sure not to rub it. Okay, the reason for that is because rubbing your hands vigorously can chap, okay, can may cause chapping to your hands, and of course chapping may cause lesions, okay, or may cause scratches or, you know, cuts to your hand. So we have to avoid that. So after we're done patting dry your hands, all we have to do is just to throw this away, get another hand towel, and then turn off the water source. Okay, so the reason why we actually we have to use a paper towel to turn off the faucet is because we may be able to, you know, pick up microorganism from the faucet, as since we already have our hands clean. So of course we do not want that to happen. Okay, so basically that's it for the hand washing procedure. And for the evaluation, there's really no evaluation needed for hand washing to check the effectiveness of it. So that's it for the hand washing procedure. So now I'll move on to the doffing or donning and doffing of PPE. Now that we're done performing the hand hygiene, it is now time for us to do the donning and doffing of PPE. Of course, the first thing we have to do is to, number one, make sure that we are aware of the reason why we have to do the proper way of donning and doffing of PPE. And that is for us to avoid the transmission of any microorganism of ineffective materials to the client, or of course to ourselves. And then in assessing, we just have to make sure that we are aware, okay, of the activities that we will do in the client's room, for us to make sure, or the rationale for that is for us to make sure that we are ready, or we are prepared, or we can prepare the materials prior to entering the patient's room. And then for the planning part, the first thing that we have to consider is that applying and removing PPE can be time consuming. So if we can delegate other personnel to take care of our clients while we are doing the procedure, of course we have to prioritize care. Number two is determine what supplies is available. Okay, and then number three is, of course, we just have to make sure that if there is a need for a special procedure in terms of handling specimen and anything that comes from the room, so we have to be aware of it. Okay, so after that, the next thing that we will do is to make sure that we remove any loose materials in our body, like name tags or like earrings or any jewelry. So let me remove my ID. So after removing any taggings, the next thing we will do is to make sure that we identify ourselves to the patient, verify the patient's information based on the agency's policy and rule, and then after that, we also have to explain the reason to the patient why this procedure has to be done, why it has to be done, and the client's participation, and of course, how this actions or how this process can help us come up with planning, and at the same time come up with the medications or the care that they need. So after that, we can now proceed with the procedure itself. Okay, so I've already done performing the hand hygiene earlier. So the first thing we will do is to apply gown. Okay, so we just have to make sure that we get a clean gown and then unfold it, making sure that the gown is not touching any soiled area, okay, with body substances. And then number two is that we slide it on our arms. Okay, so after we slide it, we have to make sure that we secure it, so we can start it on the neck. So the reason why we're securing it on the neck is to make sure that it will not fall off, that it's secured while we're using it. The next thing is to make sure that it's overlapping at the back part. The reason why we have to make sure it's overlapping at the back part is so that our uniform, of course, will not get contaminated. After we have secured that it's overlapped at the back part, we have to secure it on the waist part. And of course, the reason for that is because we want to make sure that while we're doing the procedure, it's secure and it's not gonna fall off. So let me just secure it. So the next thing we will do once we already have the gown ready for us is to, of course, we apply our mask. Okay. So in putting on the mask, we just have to make sure that we are aware, which is the top part of the mask. So normally it has a metal strip on it. And then after that, we just have to hold the strings on the side, okay, and we apply it on our ears, Okay, and then the next part of that is that we make sure that if we are using an eyeglasses, that this part is under the eyeglasses to avoid clouding. Okay, after we're done with that, we just have to make sure that we adjust the mask at the bottom part, simply because of course we have to cover our mouth and our nose, because we are breathing through it. Okay, and we don't want to make sure that the air will not just come out of the mask. And then after that, after it's secured from the bottom and on the top, for the nose bridge, if there's a metal part on this or on the mask, make sure that you press it. It's secure. Okay, the reason for that is because we don't want a microorganism to enter, of course, the mask. And at the same time, if you're using an eyeglasses, so that it will not get fog or it will not get clouded. Okay, and then after it's fixed, then that should be okay. The next thing that we will do is that we just have to make sure that we're not repeating the use of our mask. The rationale for that is because once you've used the mask, of course, there's already some moist inside it, and of course the moist of the mask will cause contamination. Okay, and it's not really healthy for us to use it all over again. Okay, so of course the next thing that we will do after we put on our mask is to put on our protective eyewear. Okay, so we just have to pull the strings at the back. Okay, so after we're done applying or putting on the protective eyewear, it's now time for us to put on our gloves. So in putting on the gloves, there's really no technique required for it. Okay, so we just have to put on the gloves. If you're using a gown, make sure that you put the cuff of the gown inside the gloves, and at the same time on the other part. Now, if you're not using any gown, you just have to make sure that the mask, or I mean the gloves, is covering the wrist. So that's it for the proper donning of PPE. Now, after we're done with the donning of PPE, let's now move on to the doffing of PPE. Now, since we're done with the donning of PPE, the next thing we will do is to, of course, the doffing of PPE, and the first thing we will have to remove is our gloves, because the gloves is the most soiled amongst all of our PPEs. So before we remove our gloves, if your gown has a tie in front, you have to remove it first. Okay, but since mine doesn't have one, so I can just remove my gloves. And in removing your gloves, you just have to make sure that you grasp the palm side and make sure that you only touch glove by glove. Okay, the reason or the rationale for that is because as much as possible, we do not want any part of the gloves, the outer part of the gloves, to touch the skin of our hands, our wrist, to avoid transmission of infection or microorganism. So we have to pull it off, okay, inside out, and then continue to hold the gloves on the other gloved hand, and then using your two fingers from the bare hands, insert it inside the other gloves. Okay, and then you just have to pull it off inside out. So again, the rationale for that is because as much as possible, we avoid touching the inside part, to avoid touching the inside part of or touching the outside part of the gloves, to avoid transferring microorganisms by direct contact. So now that we have our gloves, the next thing we will do is to make sure that we dispose it in our refuse container. Okay? So after we've have it on the refuse container, the next thing we will do is to do a hand hygiene. The reason why we're performing hand hygiene is because we may have contacted, or the rationale for that is because we may have contacted a microorganism, okay, when we were removing our gloves, okay. So to avoid transmission of microorganism, we have to perform hand hygiene. So the next thing we will do is to remove our protective eyewear, okay. Just have to lift it, okay, and make sure to put it in the proper disposal bin, okay. So after we remove our eyewear, the next thing we will do is remove our gown. So remove your gown before leaving the room, okay. So the first thing we will do is to, of course, untie it at the back, unsecure it at the back, and then grasp inside the neck part, okay, over the shoulder, and then roll it from the inside. Because the rationale for that is because the inside part is the clean part, and the outside part is, of course, the soiled part. And this is also for us to avoid, you know, transferring or acquiring any unwanted microorganism. So the next thing we will do is to have this, of course, discarded to the right receptacle. So So of course, the next thing we will do is to remove our mask. So in removing our mask, by the way, we have to make sure that we remove our mask before or once we are on the patient's doorway, or doorway. Or if you're using a respirator, make sure to remove it after leaving the room before closing the door. Okay. So of course, if you're using a mask with tie, okay, make sure to untie the lower tie first before the upper one, to avoid the mask from falling off on your chest, okay. But since right now I'm just using a mask with loops on it, all you have to do is just to move it away from your face, from your nose, okay. And as much as possible, you avoid touching the outer part of the mask, simply because the outer part of the mask is contaminated, okay. So make sure not to touch it, okay. So after that, you dispose it to the refuse container. So after you've of course dispose it to the refuse container, it's time again for you to perform hand hygiene. So it's very important for you to perform hand hygiene again, to avoid, of course, contamination, or to avoid transferring of any microorganism. Okay, so now for the evaluation part, the first thing we'll have to do is to conduct any follow-up care if indicated. And then number two, if, say for example, if any of your equipment has failed, or any of the there was an exposure of any ineffective materials, make sure that you follow the protocol or the practical guidelines. And then number three is to make sure that healthcare providers that, of course, ensure that there's an adequate supply of equipment that is available for the next personnel, okay, healthcare provider that will be assisting the client. So that's it for the return demonstration for hand washing and donning and doffing of PPE. Thank you so much, and you have a great day, ma'am.